Hi guys. Thank you so much. Welcome to Girls for STEM, guys. Thank you so much for coming to this channel. We really do appreciate, guys. And remember, we are here to encourage girls pursue STEM. We are here to acknowledge other scientists who have navigated this sector, and we are here to encourage the girls to, to be exposed to the endeavors. And guys, we have interesting guests here all the time. The reason why we bring in guests here is to showcase how these scientists and engineers are navigating science, technology, engineering, and mathematics. So, guys, thank you so much for coming to Girls for STEM to watch Girls for STEM. And we're going to start with the first guest, guys. We have a doctor, guys. So, 1 second, let's just bring her up. Hi, Dr. Pasha. Thank you so much for coming. I really do appreciate. I know you guys are busy, and I don't know right now you might be, attending to some patients, but I really do appreciate for you to come to this channel to talk to us. Thank you so much. And please, I would like you to introduce yourself.
All right. Thank you very much, and thank you for having me here.
Yes,
So, I'm Dr. Mashipisha Elizabeth. You
yes,
can call me Dr. Lizzie
yes.
because most people fail to pronounce my surname, so mostly people call me Dr. Lizzie. So, I'm a doctor.
Yes.
I'm based at Ndola Teaching Hospital, doing my internship, but
Hmm.
almost done with my internship. I'm only
Yes.
remaining with 2 months to be done with the internship, and I'm a general
Wow.
doctor for now. Yes.
Wow. That's so interesting. Thank you so much for that introduction. So, Dr. Mashipisa, Dr. Mashipisa, I have to make sure I pronounce it correctly.
That's why I say you can use Lizzie. You find it very difficult to pronounce my surname.
And you know what I do when people mispronounce my name? I tell them I'll charge you 50 cents. Each time you make a mistake, I charge you 50 cents and I'll send the bill.
Yeah.
So I wanted to ask you, Dr. Mashipisa, how did you start your STEM to be a doctor? Where did it start? Did your parents talk about being a doctor when you were young, or or did you just figure it out that you wanted to be a doctor? So the reason I ask most of my guests here, it's because each guest is unique the way the way it all started. So we would like to hear how people are navigating STEM, and this also gives an opportunity for our young kids that are trying to pursue science, technology, engineering, and mathematics to see that what they can as well do it. So how did it start?
Okay, so I was brought up by mostly my mom's relatives. Those are my
Yes,
aunties.
yes,
So from a very tender age, I was brought up with my aunties,
yes.
my mom's young sister, and the
Mm-hmm.
husband was a clinical officer.
Wow.
So we stayed at the clinic, I think, for almost like 4 years. So most
Wow.
of the times, I think it's usually what they say about when you say something, like mostly when
Yes,
parents keep saying, because most of the times we'll be like, you know what, you would be a doctor, you're going to be a doctor. And mostly because I used to stay at the clinic, I would see him wear the coat, I would probably see patients there. So mostly it came from there, and that was at a very young age. So I think it started when I was very young, and from then I've always been like, okay, I'm going to be a doctor. Even when I started doing medicine, I entered into CBU first year, because
yes,
first year you're not yet quoted into medicine or any other category. So when they
yes,
told me, okay, you know what, you'd have to choose like first option medicine, then you need to put a second option. I
yes.
literally refused to put a second option. So what I
Are
did
you
was I put
serious?
medicine. I put medicine for my first option, and I put
Yes.
medicine for my second option as well. So I
You
think it's
were really
something that,
serious.
yeah, so it's something that I've always wanted to do, and also motivated by my uncle who was a clinical officer, and from what I saw. So it's something that I've grown up wanting to do.
Wow. So do you remember how old were you when you were thinking when you were seeing that? How old were you?
I think I should have been somewhere 9, 10, 9, 10 years old.
Wow, guys, you see, she was about 9, 10, and the environment around her was conducive for her to spark that idea, to ignite that idea that she would like to be a doctor. So, you know what, Doc, I always talk about how parents should provide that environment where
Mhm.
they are, an environment that can trigger a kid to either be an engineer, a scientist, a technologist, just to provide that environment, especially for parents. We really need to provide that environment. For example, there was another engineer. He's a student. He was saying he used to watch something on Discovery Channel. So when he
Ah,
was watching that, that sparked his interest. I was like, whoa. So, guys, as parents, we really need to make sure we can provide that environment for our kids so that they can, pursue science, technology, engineering, and mathematics. So then what happened after that? How did it now get into medicine? Are you talking to people around you that you want to be a doctor or what?
so when I completed grade 12, yeah, so I had to go to university, of course, and because I already knew what I wanted to do, so I
Mhm.
used to work towards that. And when I got into medicine, I got to have somebody to mentor me. So
Yes.
I have someone who's a pediatrician who's
Yes.
always mentoring me, and I have
Mhm.
other friends who have done very well in the medical field who are also mentoring me, but mostly it's the pediatrician because, in as much as I've done general medicine, I've
Mhm.
always loved to do pediatrics. So I would like to move from general medicine and specialize in pediatrics because that's something that I really feel like I love and
Yes.
would be very happy to do.
Wow. Wow. Thank you, Doc. You just emphasize the point that I always talk about, that, we need to have role models in our lives. Unfortunately, I didn't have a role model when I was doing my career in engineering, to see somebody who looks like me or somebody who has done this career before. And I was fortunate to have professors around me. Men actually mentored me. And sometimes men talk about, okay, senior St. Joe's for STEM, maybe we're not part of it. I always challenge them. I said, no, I was mentored by men. So men are also part of this. So it's very important that our kids have a role model, just like you are saying, someone to mentor you, someone to look up to. And also, it's easier to see other people who have done it so that you can really, really get inspired or see the variety of the professional, especially career, which one you want to take.
Yeah.
That
So
really just nails it. Go ahead.
yeah, so even when you talk about mentorship, because I have my cousin, so
Yes,
because she's seen me, like we used to stay together, so she's seen me go to school and do
yes.
medicine and eventually become a doctor. She's also
Mhm.
headed for the same route. So mostly she's even, no
See,
matter how
see,
much you tell
guys.
her, if you tell
Yes.
her to say, you know what, you have sleepless nights, she's just like, I don't care. I just want to be like you. I just want to wear
Really?
what you're wearing. I want to
Oh
be in the
my
hospital and see
God.
patients. Yeah,
Yes.
so she's doing her
And
best there.
where's your stethoscope, Doc? I always envied
Oh,
that. Please show
let
us.
me just
I
get.
always envied that stethoscope.
I Yeah. So mostly it's more pediatrics than anything else.
Wow, wow,
Yeah.
wow,
So
wow.
yeah.
Wow, that is so nice. See, when we are when we showcase our career, guys, especially in engineering, very engineers and doctors, they don't talk about their career thinking, oh, maybe you're boasting too much, because they want to label us engineers, doctors, like we are not people, like we are just those people. No, we are just human beings, and we want to talk about this to encourage girls, young boys, everyone, to pursue science, technology, engineering, and mathematics. And see, when kids see people like us, then they say, wow, I want to be like her. I want to be like that. I work for space missions, space systems, and I love space systems, and I want to showcase to the young ones that they too can be an engineer and they can work for space missions. So that's really interesting. I really do appreciate Doc. So Doc, I have one question. So what are the challenges that you've had during your STEM career coming to where you are? What are some of the challenges that you've encountered?
So medicine. It's a very very funny journey. So this is let's say grade 12, right? You have
Yes.
very good results and you're so sure. Okay, if I go to university, I'm going to be getting A pluses. But
Yes.
the medical field, and I guess engineering field or technology field should be almost the same.
Yes.
So it's hard. So you come to a point where when you're in grade 12, an A
Uh-huh.
plus was like, oh yes, I just have to get A pluses. But once you're in medical school, your focus becomes, okay, I just need to pass my exam because this is so hard. So
I
sometimes you get
remember.
into depression because you're not
Yes.
used to maybe getting low marks. You're used to getting high marks,
Yes.
but now you're in school and in a class, maybe you find that having those low marks is actually okay as long as you've passed. So it's a
Yes.
little bit challenging, it's a little bit
Mhm.
depressing, but mostly having friends around, study
Yes.
groups as well. And
Mhm.
if you can have a mentor, somebody that you can easily go and talk to say, okay, you know what? I had this exam, I feel like this, I feel like I can't do it anymore. You always have people who will
Yes.
talk to you to say, you know what? You've come a long way. You can
Mhm.
do this. If this person did it, you can also do it. There's nothing hard for you not to do.
Wow. My next question, I wanted to ask you that what drives you, and you've just answered that. That's really, really interesting. Thank you so much. And the other question I wanted to ask you is, and guys, my viewers, each person, each guest has got a unique story, different stories, guys. The reason we want to hear from different people, it's because we want to see ourselves in some of these people, and just to encourage that, especially women, that we can do it. Here we are, women, pursuing science, technology, engineering, and mathematics. So guys, encourage the young ones, encourage women. I did my STEM at a very late age. I didn't do STEM right away due to so many reasons, privileges back home in Zambia, and just so many things. But you can enter STEM, remember, guys, at any point. You can change your career and do anything you want. So, Doc, the other question I wanted to ask you is, knowing that there are different privileges and different opportunities in different countries. So, what would you say to a girl growing up today? How can they enter into STEM? Can they pursue science, technology, engineering, and mathematics, knowing that there are different types of resources around us and opportunities?
Mm, yeah, so for, I don't know about elsewhere, but mostly for a place like a developing country like Zambia, so most of the times, most girls will fail to maybe go into school or university because of financial reasons. But
Yes,
like now, we have a lot of organizations that actually support girl children when it
yes,
comes to education. So all I would say is all you need is focus, and there'll
yes,
always be someone out there who's willing to help. For example, I did my medicine on a bursary, on a full scholarship, full government bursary.
yeah,
I'm sure if not for the
correct.
bursary, probably I wouldn't have pursued. Yeah, so all you need is to focus. Financial issues or scholarships usually
Mhm.
just come in if you're hardworking. There's always someone out there to help. And there are a lot of opportunities for females, especially because people are trying to encourage girl children to enter into STEM.
Yes,
Yeah.
yes. Wow, wow. Thank you so much. And so, what is your next step from here, Doc, in your career? What are you trying
So
to specialize into?
I'm excited.
Uh-huh.
I'm excited that I'm almost done with my internship. So it means that's another step.
Yes,
I'm probably going to
yes,
start something else. So I love pediatrics. Personally, I love pediatrics. I would like to get into pediatrics, but I also love public health.
yes,
So I want to do a master's in
yes,
public health. Then I can also specialize in
yes.
masters in pediatrics. Yeah. So
Wow,
yeah,
wow.
those
Thank you
two.
so much. Wow, that's really interesting. Thank you so much. I know, Doc, we are at the hospital right now, and you just came in to come and spend some time with us. I really do appreciate. I know most of my guests are very, very busy, and it's not easy. I do appreciate, and I would like to have you again to see, how it's going and what you're doing. Please come again and visit us.
No problem. Thank you.
Thank you so much. Thank you so much. Guys, so that was Dr. Mashipisha. I always make a mistake. I think she's going to charge me for making a mistake pronouncing her name. Please forgive me. But I'll get used to it. That means you should be coming more, Doc, on our channel so that we can see you again. Thank you so much. Guys, that was very interesting. So, she's a doctor. She's just about to graduate. She's doing her internship. And guys, so encourage our girls. They can be anything they want. And remember what she was saying. She was saying she was exposed to medicine around her. Her relatives was doing clinical office. So that's where she saw it. So that's why, guys, I always talk about having an environment where you can encourage your kids to pursue science, technology, engineering, and mathematics.